year, millions of Americans discharged from the hospital, they're readmitted within 30 days. But according to the Agency for Healthcare Research and Quality, effective transitional care can lead to better health outcomes and help you avoid a return to the hospital. So joining us to discuss from WellMed is Dr. Jason Nichols. Thank you so much for waking up with us.
Hey, thank you for having me. Good morning.
I think this is such an important topic because I've had family members discharged and then readmitted because it felt like they were discharged too soon. So why are readmission rates so high, doctor?
That's a good question, and your experience is not alone, as I have family members in the same boat as well as patients. But one of the common things, there are a couple. One is around following up with your primary care physician. And that is obviously one of the core concepts that I want to discuss. There's issues around making sure that you have your medications. We call that medication reconciliation or management. And then also around social issues. So those are three common reasons in regards to the transition process that actually can cause patients to be readmitted at a much higher clip.
So how can we help reduce readmission and stay healthy at home? I know you just kind of went through a bunch of things.
Yeah. The first one is following up with your primary care provider. I can't express that enough. That is really priority number one once you've been discharged from the hospital. They are the quarterback of your healthcare team. So their whole purpose is to actually trying to keep you out of the hospital so you don't have to go back. They can help with your coordination of following up with your subspecialists, such as a cardiologist. And if there are issues, say, for instance, around medication costs, that is a big one as well. Sometimes patients are just scared to actually discuss that they can't afford medications, or even the disease process as a whole. They're afraid of that. So being able to really have that connection with your primary care doctor, following up from the hospital, is just absolutely critical.
And what are some best practices if, let's say, we had to go to the emergency room or urgent care?
Glad you asked, and I'd say pretty similar. You really want to follow up with your doctor, your primary care physician, as quickly as possible. Again, when you're discharged, within the first 72 hours, the most likely cause of going back to the hospital is actually medication errors. So getting in to discuss with your primary care doctor the medications that you've been discharged on is absolutely critical, even from the ER. That way they can adjust accordingly, make sure you're not on too much or too little medication. And same thing, making sure that if you need to follow up with a specialist, that they're able to get you in a timely manner. One other thing that I would like to highlight as a patient myself, like we all are, is you want to make sure you write down questions, because when the doctor's in there, time's a little bit short at times and we forget things. But you want to make sure you have a set of questions that you've thought about that you want to ask your doctor, so you can make sure you're getting the answers and you feel comfortable with the plan so you don't have to go back.
Okay, I was gonna say, that's what I always do. My doctor, I like whip out a whole list of questions, or if I take my daughter to the pediatrician, I have that. So thank you, I'm glad that's one of the tips. Where can people go for more information?
Sure, it is agehealthytoday.com, and there'll be a lot of information there about what we discussed today around the transition process.
Well, doctor, I really appreciate you, and thank you for sharing your perspective as a doctor, but also as a patient.